Now I am demonstrating some simple exercises for patients with low backache. It is important to note that exercise should be started only when patient has become pain-free. It should be discontinued if the pain comes up on exercising. All the exercises should be gently and in a rhythmic movement. Always start with gentle warm-up with slow movements of spine in all directions. Spinal exercises are divided into three parts, that's flexion exercise, extension exercise and pelvic rotation exercises. Let's start with the flexion exercises. Patient needs to do both stretching and strengthening exercises. We first give a demonstration of stretching exercises in flexion. The first one. Now the first exercise among stretching of the flexion exercises, knee to chest exercise. Patient in supine position, slide one heel to buttocks. Now lift the heel and hold the knee with both hands and press towards chest. Hold for about 10 seconds. Now go back to start position. Repeat the same exercise with the other limb too. 10 to 15 repetitions are needed. The same exercise can be done with both limbs together. Both limbs together. Second exercise among stretching flexion exercises, curl ups. Patient in supine position, slide both heels to the buttocks. Now raise both shoulders simultaneously to touch to the knees with hands. Take care not to force the movement. Maintain for 2 to 3 seconds. Now go back to first position and relax. 8 to 10 repetitions are enough. Now we come to pelvic rotation exercises. Patient in supine position, slide heel to the buttocks. Keep hands on the sides. Rotate knees to one side to touch the surface with the knee, while the opposite shoulder keeps touching the surface, opposite surface. Repeat the same exercise for the other side. 10 repetitions are needed. Now we come to the extension exercises, both stretching and strengthening. The stretching exercise is first. First stretching exercise is prone press up. So patient lies in prone position with hands placed under the shoulders. Then extend the elbow and lift the thorax up, but keep the pelvis down on the surface. Stretch the spine gently. Now come back to start position. The next exercise is active stretching of the lumbar spine. Patient in hand knee position. Pull the stomach in and sag the dorsal lumbar spine, creating a lumbar extension. Yeah, stomach in and spine extension. Okay, now come back to neutral position. The third exercise, patient has to stand straight, hands placed in the lower back area, lean. The next exercise, patient stands straight, hands placed in the lower back, lean backwards and hold the stretch for 10 seconds. Come back to normal position. Repeat such movements. Okay. Now we come to the extension exercises, the strengthening exercises. Again, the patient in lying down prone position.
Start.
Patient in prone position with arms by the chest height. Raise both the shoulders gently. Hold for about 10 seconds. Go back to start position. Relax for 5 seconds. Repeat the same exercise. Repeat 8 to 10 times. That is enough. Now the second strengthening exercise, patient in same posture, that is prone position. Keep the knee straight, raise one leg and the opposite shoulder as much as possible within comfortable limits. Hold for about 8 to 10 seconds. Come back to start position. Now lift the other shoulder and the knee, keeping the knee straight. Hold for 8 to 10 seconds. Then go back. 8 to 10 repetitions are enough. Okay, now we go to the third strengthening exercise. Patient in same prone position. Raise both the shoulders and the straight legs with an attempt to balance on the abdomen. Hold for 8 to 10 seconds. 5 repetitions are enough. Okay. Now let's talk about postures. Patient should know how to get into the bed and how to come out of the bed. So how to get into the bed? First, patient sits on the edge of the bed, take support from the elbow and lie down on one side, simultaneously bringing folded legs to the bed. Now you are in lateral position. You can now roll to supine or prone position, whatsoever you want. All these movements should not be combined together. Now how to come out of the bed? Roll onto the edge of the bed in a lateral position. Hang your knees and simultaneously take support from the elbow and the hand and raise to sitting posture. Now how to lift objects from the floor? Very important. Now how to lift objects from the floor? There should be very minimal bending from the spine. Basic movement is hip and the knee. Ask the patient to lift by stooping down, by bending the hip and knee, so to bring the object close to the body. The other way is keep one leg in front, the other behind, bend down on the hip and knee so that you reach to the object, and then stand up by extending the knee and the hip joint. Now patient needs instruction about standing also. Instruct the patient not to stand for long with hips and knees fully extended. One has to switch the weight from one leg to the other frequently. Okay. And while sitting, the chair should be comfortable with a good lumbar support to maintain the lumbar lordosis. One can use a thin pillow between lower back and the chair back. The type of bed or the mattress, patients will frequently ask you. The mattress should be firm, not hard, not too soft. Good quality spring mattresses, they distribute the body weight equally and are good option. It's very important to understand that no exercise should be done if the pain increases. Always start the exercises gentle, rhythmic, and gradually build up the exercises. That will definitely give you a good result. Okay, thank you very much.